topic is the lobes involved in various lung diseases. So the questions are, the first one is asbestosis is involved with what lobe, and the second one is ankylosing spondylosis. So this is associated with which lobe? So in this video we'll find these answers and we'll learn in detail. So firstly, there are just two lobes. So the upper lobe, there is upper lobe. So upper lobe has a mnemonic, that is charts. So we'll be filling this. So C stands for the poll workers. Under C there is coal workers. So let's write it down. C for coal workers. Pneumonicosis, pneumoconiosis. So that is nothing but the CWP. Then comes the silicosis, and then the berylliosis. Next we have H. So H is nothing but the histiocytosis. X, that is the LCH. Then comes the A for the ankylosing spondylitis. So this is the ABPA. So let's recap. So we dealt with the lobes and various diseases. We focused on the upper lobe. So C stands for the coal workers, pneumoconiosis, the CWP. Then comes the silicosis and berylliosis. Then H for the histiocytosis X, that's the LCH, and the ankylosing spondylosis and ABPA. Then comes the letter R and T. So here R, it stands for the radiation. Then comes T. T stands for the tuberculosis. Then comes S. S for the sarcoidosis. Now we'll be focusing on the lower lobes. So under the lower lobes there comes the rheumatoid arthritis. Then is the asbestosis. So here the mnemonic is nothing but RADS. So asbestosis, and there is a letter I as well. So I for the idiopathic pulmonary fibrosis, that is the IPF, and the non-specific interstitial pneumonia. So in short, this is known as the NSIP. So let's recap. So we dealt with the lobes in various diseases. Now we are looking at the lower lobes. So this includes R for radiation, then T for tuberculosis, S for sarcoidosis. So this was pertaining to the upper lobe. Now lower lobe we have a mnemonic, that is RADS. So R for the rheumatoid arthritis as well as A for asbestosis. Next I for the idiopathic pulmonary fibrosis, that is IPF, and N for then there is N, that is a non-specific interstitial pneumonia. That is NSIP. Now we look at the drugs. So what does this drugs involve? The drugs, it includes the bleomycin. There's bleomycin. There is busulfan. Next there is also the amiodarone. There's amiodarone as well as the methotrexate and the nitrofurantoin. Next comes S. S stands for the scleroderma. Now let's just recap. So we saw the drugs. Drugs, it includes the bleomycin, the busulfan, the amiodarone, the methotrexate as well as the nitrofurantoin. Next comes S. S stands for the scleroderma. Now let's answer our questions. So the first question we asked was the asbestosis. Asbestosis is associated with which lobe? So the answer here is that the asbestosis, it is associated with the lower lobe. The next question we asked was with the ankylosing spondylosis. The ankylosing spondylitis. So this is associated with which lobe? It is associated with the upper lobe. Now let's recap. So we saw the asbestosis, it is associated with the lower lobe. Then the next question we asked was the ankylosing spondylitis. It is associated with the upper lobe. So this was about the lobes involved in various lung diseases. To learn and grow daily, please do subscribe.